Which of the following conditions can be triggered by Rh incompatibility between mother and fetus? A. Hyperemesis gravidarum. B. Preeclampsia. C. Hemolytic disease of the newborn. D. Postpartum hemorrhage. E. Gestational diabetes. The answer is C. Hemolytic disease of the newborn. Of the conditions listed, the only one that is associated with Rh incompatibility between mother and fetus is hemolytic disease of the newborn, otherwise known as hemolytic disease of the fetus and newborn. In this condition, antibodies from the mother's blood attack the blood of the fetus. This is a major cause of fetal and newborn mortality and morbidity. Which of the following maternal, fetal blood types can lead to hemolytic disease of the newborn? A. Rh positive mother, Rh positive fetus. B. Rh negative mother, Rh negative fetus. C. Rh negative mother, Rh positive fetus. D. Rh positive mother, Rh negative fetus. The answer is C. Rh negative mother, Rh positive fetus. Hemolytic disease of the newborn occurs when an Rh negative mother is carrying an Rh positive fetus. The mother must have previously carried an Rh positive fetus and become sensitized to Rhd antigen during miscarriage, pregnancy, due to placental rupture, or during delivery. Then, during a second pregnancy, anti-Rhd antibodies from the mother's immune system can cross the placenta and attack the blood cells of the fetus, causing hemolytic anemia. What treatment can prevent the development of sensitization to Rhd antigen in an Rh negative mother carrying an Rh positive fetus? A. Therapeutic abortion. B. Rhd fetal serum injections. C. Short course immunosuppressant treatment. D. RHO, D, immune globulin. The answer is D. RHO immune globulin. Rh sensitization can be prevented by treatment of an Rh negative mother with RHOD, immunoglobulin at 28 weeks. Then again within 72 hours of delivery. This is a solution of IgG antibody to Rhd, which is able to destroy any fetal red blood cells that enter the mother's bloodstream before her own immune system is able to develop a sensitization. A nurse working in labor and delivery is caring for a client that has been diagnosed with an incompetent cervix. The client has been informed by the physician she is now at risk for a spontaneous abortion. The client asks the nurse about possible interventions. The nurse is aware the procedure performed for an incompetent cervix is called A. McCarrine-Olds procedure. B. Shirodker procedure. C. Colbripy. D. Dilation and curettage. E. Tubal ligation. The answer is B. Shirodker procedure. A Shirodker procedure involves sewing a suture in and around the cervix to hold it closed. This is usually performed within the first trimester and later removed when the risk of miscarriage has lessened. A pregnant woman at 43 weeks gestation is having labor augmented with oxytocin infusion. Which of the following best categorizes this particular drug? A. Prolactin. B. Antidiuretic hormone. C. Growth hormone. D. Erythropoietin. E. Thyroid stimulating hormone. The answer is B. Antidiuretic hormone. Oxytocin is often used to help augment labor by inducing contractions. This hormone is naturally made in the body and works as an antidiuretic hormone, thus promotes the excretion of water. In labor, this hormone also works to stimulate uterine contractility. You are the nurse taking care of a 76-year-old female who complains of vaginal dryness that is occasionally painful during intercourse. She is diagnosed with vulvovaginal atrophy. Which of the following is the best initial treatment? A. Systemic estrogen. B. Diphenhydramine. C. Propranolol. D. Topical estrogen. E. Oxybutynin. The answer is D. Topical estrogen. In a patient with atrophic vulvovaginitis, a condition that causes thinning of the vaginal and vulvar tissue, resulting in inflammation, diminished lubrication, and subsequent pain, the best initial treatment option if the condition is distressing to the patient is application of topical estrogen. Atrophic vulvovaginitis is a common condition in postmenopausal women as the level of circulating estrogen decreases, and therefore estrogen-mediated effects on female tissues are diminished. With the significant decrease in estrogen to the vagina and vulva, inflammatory and painful symptoms may occur, as in this patient. By applying a topical estrogen cream to the affected tissues, this allows the patient to supplement the estrogen that was lost following menopause, while not exposing the patient to the potentially negative effects, for example cardiovascular, of systemic estrogen supplementation. Propranolol is a beta-adrenergic antagonist and has no role in the treatment of atrophic vulvovaginitis. Oxybutynin is an anticholinergic medication that is used to treat spastic bladder, among other conditions. It has no role in the treatment of atrophic vulvovaginitis. Diphenhydramine is an antihistamine medication that has a wide variety of uses, but none known to treat atrophic vulvovaginitis. You are the nurse taking care of a 28-year-old G3P2 who is at 33 weeks gestation. She goes into labor, and the physician orders administration of a tocolytic medication. Which of the following medications is a tocolytic? A. Sertraline. B. Terbinafine. C. Lisinopril. D. Furosemide. E. Terbitalin. The answer is E. Terbitalin. A beta-2 adrenergic agonist, is the only medication listed that has tocolytic, or labor-repressing, anti-contraction, properties. It is one of the most common medications used for tocolysis in pregnant women. Another commonly used tocolytic agent is nifedipine, a calcium channel blocker. The other choices are incorrect. Lisinopril is an angiotensin-converting enzyme inhibitor, ACEI, that is commonly used to treat hypertension, among other conditions. It has no reported use as a tocolytic. Furosemide is a loop diuretic that is commonly used in the treatment of hypertension. It has no reported tocolytic properties. Sertraline is a selective serotonin reuptake inhibitor medication used to treat a number of conditions including major depressive disorder and generalized anxiety disorder, among others. Terbinafine is an allopurinol antifungal medication used to treat conditions such as tinea corporis or tinea cruris. Basal body temperature is determined by dash. A. Taking the temperature before bed. B. Taking the temperature in the afternoon. C. Taking the temperature in the evening. D. Taking the temperature mid-morning. E. Taking the temperature before rising. The answer is E. Taking the temperature before rising. The basal body temperature is a method many women use to determine when ovulation occurs. To take a basal body temperature, One must use a basal thermometer, which is more sensitive, and take their body temperature before getting out of bed, or even sitting up, each morning. This method is utilized the best if a woman wakes up and takes her temperature at the same time daily. A nursing student is participating in clinical practice on a labor and delivery unit. He is learning how to measure contractions. He knows that contractions are measured by frequency, duration, and intensity. Which time frame correctly describes how the student should measure the frequency of contractions? A. The increment of the first contraction to the decrement of the second. B. The increment of the first contraction to the decrement of the first. C. The increment of the first contraction to the increment of the second. D. The acme of the first contraction to the acme of the second. E. The increment of the first contraction to the acme of the second. The answer is C. The increment of the first contraction to the increment of the second. Increment is the beginning or rise of the contraction. Acme is the peak of the contraction. Decrement is the fall of the contraction. Frequency is measured from the beginning of one contraction to the beginning of another, so it should be measured from the increment of the first contraction to the increment of the second contraction. While caring for a laboring patient, the nurse is called into the room because her patient felt a gush of fluid. Which of the following should be the nurse's next action? A. Turn the mother to her right side. B. Alert the physician. C. Assess fetal heart rate. D. Change the sheets. E. Inform the mother of what she should expect next. The answer is C. Assess fetal heart rate. The nurse must suspect rupture of the membranes, amniotic sac. Assess fetal heart rate if rupture of the membranes may have occurred. With rupture comes the potential for cord prolapse. Assess fetal heart rate for baseline variability. Marked variability may be cause for concern and the nurse should monitor the patient for signs of infection. Which of the following symptoms is not a danger sign of pregnancy? A. Fever or chills. B. Persistent vomiting. C. Increased urination. D. Vaginal bleeding. E. Swelling in face or fingers. The answer is C. Increased urination. It is important for the obstetric registered nurse to recognize the following danger signs of pregnancy: profuse vaginal bleeding, severe headaches, visual disturbances, abdominal pain, persistent vomiting, fever, chills, or swelling in the face or fingers. These may be signs of placental abnormalities, hypertensive disorders or pregnancy, maternal infection, or hyperemesis. Increased urination may be concerning to some women, but during pregnancy, the increased mass of the uterus induces pressure upon the bladder. Which of the following tests may be used to assess the risk for neural tube defects in the fetus during pregnancy? A. Alpha fetal protein, AFP, test. B. Ultrasound. C. Non-stress test, NST. D. Chorionic villus sampling, CVS. E. Amniocentesis. The answer is A. Alpha fetal protein, AFP, test. The alpha fetal protein test is the only test that can predict neural tube defects in a fetus during pregnancy. CVS can detect fetal karyotype, sickle cell anemia, phenylketonuria, PKU, Down syndrome, and Duchenne muscular dystrophy. Amniocentesis can detect genetic disorders and lung maturity. Ultrasounds provide images of the fetal position, measurements of the fetus and placenta, and can confirm pregnancy and gestational age. Non-stress tests, NST, are used to record fetal heart rate to assess fetal well-being after 28 weeks gestation. What is the proper management of atypical squamous cells of undetermined significance, ASCUS, or low-grade intraepithelial lesion, LSIL, in women aged 21 to 24? A. Cervical conization. B. LEEP, loop electrosurgical excision procedure. C. Repeat cytology in 1 year. D. Repeat cytology in 6 months. The answer is C. Repeat cytology in 1 year. ASCUS or LSIL in women aged 21-24 should be managed by repeat cytology in 1 year. Neither cervical conization nor LEEP, loop electrosurgical excision procedure, would be appropriate in a patient of this age or presentation. What follicle-stimulating hormone, FSH, and luteinizing hormone, LH, levels would be present in a patient with premature ovarian failure? A. FSH greater than 120 micro-international units per ml and LH greater than 80 micro-international units per ml. B. SH greater than 25 micro-international units per ml and LH greater than 40 micro-international units per ml. C. FSH greater than 40 micro-international units per ml and LH greater than 25 micro-international units per ml. D. FSH greater than 80 micro-international units per ml and LH greater than 120 micro-international units per ml. The answer is C. FSH greater than 40 micro-international units per milliliters and LH greater than 25 micro-international units per milliliters. Premature ovarian failure is the loss of ovarian function in an individual under the age of 40. A FSH greater than 40 micro-international units per milliliters and LH greater than 25 micro-international units per milliliters would be indicative of this condition. What are the signs and symptoms of ectopic pregnancy? A. Cramping and abdominal mass. B. Nausea and diplopia. C. Fundal tenderness and vertigo. D. Abdominal pain and vaginal bleeding. The answer is D. Abdominal pain and vaginal bleeding. The most common symptoms of ectopic pregnancy are moderate to severe abdominal pain and vaginal bleeding. Pain may be cramping or sharp. Bleeding can be heavy and the individual can even begin to bleed into their abdominal cavity. Ectopic pregnancy is not consistent with fetal survival and requires treatment with methotrexate or, in the case of bleeding, surgery may be indicated. A patient tells her nurse that since week 26 of her current pregnancy, she has been experiencing a raised, itchy red rash on her abdomen and chest. This is her first pregnancy. She has never had this before and she has made no other changes in diet, detergents, or lifestyle. Which of the following might describe her condition? A. Urticaria from food allergy. B. Heat rash. C. Pruritic urticarial papules and plaques of pregnancy, PUP. D. Dermatitis herpetiformis. The answer is C. Pruritic urticarial papules and plaques of pregnancy, PUP. The most likely cause of her rash is pruritic urticarial papules and plaques of pregnancy, PUP, a condition affecting about 1 in every 200 pregnancies. While she could be having an allergic reaction, dermatitis herpetiformis or urticaria, or an inflammatory eruption such as heat rash. These are less likely due to their absence before pregnancy and the absence of any significant changes in her diet or lifestyle. How is glomerular filtration rate, GFR, affected during a normal pregnancy? A. Decreases by 15%. B. No change. C. Increases by 15%. D. Increases by 50%. The answer is D. Increases by 50%. In the average normal pregnancy, the GFR increases by upwards of 50%. This correlates with an overall 50% increase in blood plasma volume. The term placenta previa describes which of the following conditions? A. The placenta separates from the uterine wall. B. The placenta develops before the uterine lining is mature. C. The fetus is inferior to the placental position. D. All or part of the placenta is positioned between the fetus and the cervix. The answer is D. All or part of the placenta is positioned between the fetus and the cervix. In placenta previa, the placenta develops in such a way that all or part of it is positioned in the lower one-third of the uterus, placing it between the fetus and the cervix. This can cause the placenta to tear and bleed. The most common sign is painless vaginal bleeding in the third trimester, generally after week 32. A 25-year-old female primigravida presents to the clinic for a prenatal visit and is concerned with new onset skin changes she has noticed lately. The nurse caring for this client is aware that there are several skin changes associated with pregnancy. All of the following are skin changes associated with pregnancy except dash. A. Palmar erythema. B. Subclinical jaundice. C. Chloasma gravidarum. D. Heger's sign. E. Linea nigra. The answer is D. Heger's sign. Heger's sign is indicated by a softening of the portion of the uterus between the uterus and a portion of the cervix. The remaining choices are all examples of various skin discolorations commonly associated with pregnancy. The nurse advises a woman with mild preeclampsia to do all of the following except dash. A. Check blood pressure often. B. Limit water intake. C. Weigh herself daily. D. Measure the protein in her urine. E. Keep track of fetal movement. The answer is B. Limit water intake. It is not necessary to limit water intake in women with preeclampsia. It is important that women with preeclampsia drink at least 8 glasses of water per day. The ingestion of water may even help reduce swelling. Checking blood pressure and body weight frequently are important in tracking fluid levels. It is also important to keep track of fetal movement and notify a provider immediately if decrease in movement is noted. Women who are preeclamptic may spill protein into their urine as a result of malfunctioning kidneys. The ideal position for a pregnant to lie on the bed. A. Have the mother raise her legs. B. Turn the mother on her right side. C. Turn the mother on her left side. D. Place the mother in Trendelenburg. E. Place the mother in the tripod position. The answer is C. Turn the mother on her left side. Placing the mother on her left side can increase placental blood flow and increase the baby's oxygenation. Placing the mother on her right side, in Trendelenburg, head down, in the tripod position, sitting forward, hands on knees, or with her feet in the air is not of equal benefit. Which of the following assessments is not a focal point of the postpartum assessment? A. Bonding, including maternal, fetal and family dynamics. B. Fundus, including height, location, and consistency. C. Vital signs, including blood pressure and pulse. D. Stool assessment, including consistency and color. E. Lochia, including color and volume. The answer is D. Stool assessment, including consistency and color. The postpartum assessment includes vital signs, blood pressure, pulse, fundus, location, height, consistency, lochia, color, volume, urinary output, measure first void, and bonding between the mother and infant. The postpartum assessment is valuable because it allows for nursing interventions at warning signs of postpartum complications, including infection, hemorrhage, and uterine atony. Stool assessment is not a vital part of the postpartum assessment because it does not lend information to the assessment of potential danger signs. Which of the following ethnic groups should consider genetic counseling for thalassemia? A. Native Americans. B. Northern Europeans. C. African American. D. Mediterranean ancestry. E. Jewish. The answer is D. Mediterranean ancestry. Thalassemia, an inherited autosomal recessive blood disorder, is characterized by an abnormal form of hemoglobin. Those of Mediterranean ancestry may be carriers of the disease and genetic counseling is recommended. African Americans are at risk for carrying the gene for sickle cell disease, another inherited blood disorder that alters the form of hemoglobin. Northern European descendants of Jewish ancestry are at risk for carrying Tay-Sachs disease, a rare, inherited nervous system disorder. Native Americans are not commonly at risk for passing on genetically inherited disorders. How can endometriosis affect fertility and miscarriage rates? A. Decreases fertility and increases risk of miscarriage. B. Increases fertility and decreases risk of miscarriage. C. Decreases fertility and decreases risk of miscarriage. D. Increases fertility and increases risk of miscarriage. The answer is A. Decreases fertility and increases risk of miscarriage. Endometriosis will increases risk of both infertility and of miscarriage. This may be due to a paracrine effect as hormones are released locally by ectopic endometrial tissue, causing disruptions in hormone levels required for implantation and for sustaining an implanted embryo before the formation of the placenta. Endometriosis is more common in the presence of what food allergy-related condition? A. Lactose intolerance. B. Anaphylaxis. C. Endometriosis is unrelated to any type of food allergy. D. Celiac disease, gluten allergy. The answer is D. Celiac disease, gluten allergy. In a study surveying 120 women with endometriosis, the prevalence of celiac disease, an autoimmune condition triggered by ingestion of gluten, was nearly 4 times higher than the general population. No association has been made between the presence of endometriosis and lactose intolerance or incidence of anaphylaxis. What is the most common cranial mononeuropathy in diabetic patients? A. Cranial mononeuropathy 6. B. Bell's palsy. C. Auditory neuropathy. D. Third nerve palsy. The answer is D. Third nerve palsy. Third nerve palsy, cranial nerve 3, the oculomotor nerve, is the most common cranial mononeuropathy seen in diabetic patients. They will present with ptosis, dilated and fixed pupils, and an outward and slightly downward deviation of the eye. Bell's palsy involves unilateral facial paralysis as a result of damage to the facial nerve, cranial nerve 7. Cranial mononeuropathy 6 is caused by damage to the abducens nerve, cranial nerve 6. Signs of damage include inability to laterally rotate the eye and/or double vision. Auditory neuropathy may be a result of damage to the vestibulocochlear nerve, cranial nerve 8. The most pronounced symptom is loss of audition. What condition is described by the following? A defect of copper excretion, leading to copper overload and feedback inhibition of ceruloplasmin synthesis. A. Wilson's disease. B. Huntington disease. C. Ceruloplasminemia. D. Hereditary hemochromatosis. The answer is A. Wilson's disease. Wilson's disease is characterized by a defect of copper excretion, leading to copper overload and feedback inhibition of ceruloplasmin synthesis. This results in copper accumulation, primarily in the liver and the brain. Signs and symptoms include liver failure, cognitive deterioration, clumsiness, and changes in behavior. Symptoms often start in adolescence, but can start any time between 6 to 20 years old. Ceruloplasminemia is a rare condition of iron accumulation in the basal ganglia, retina, and liver. Hereditary hemochromatosis is also a disorder of iron accumulation, often caused by mutations in the HFE gene. Huntington disease is a genetic neurodegenerative disease unrelated to any mineral storage disorders. A 62-year-old male client is admitted to the hospital with acute pancreatitis. The client has a well-established history of alcohol abuse. The nurse caring for this client is aware he may exhibit withdrawal symptoms during the inpatient course. The nurse's plan of care for this client should include assessment for all the following symptoms of alcohol withdrawal except A. Hypersomnolence. B. Tremors. C. Visual hallucinations. D. Hypertension. E. Seizure within the first 24 hours. The answer is A. Hypersomnolence. The symptoms of alcohol withdrawal may include confusion, disorientation, and anxiety. Hypersomnolence or excessive sleep is not associated with this condition. Additional symptoms may include agitation, hypervigilance, tremor, rapid and irregular heartbeat, hypertension, seizure, and hallucinations, mostly visual. Approximately 80% of strokes are of what type? A. Hemorrhagic. B. Transient ischemic attack. C. Ischemic. D. None of these. The answer is C. Ischemic. Approximately 80% of strokes are ischemic, either caused by thrombus or emboli. Hemorrhagic strokes only account for approximately 15% of all strokes, but are significantly more lethal and account for 30% of all stroke deaths. They involve the rupturing of a weakened blood vessel in the brain and subsequent bleeding in the surrounding areas. Transient ischemic attacks are not considered true strokes, and are often referred to as mini strokes. Which artery is most commonly involved in ischemic stroke? A. The middle cerebral artery. B. The anterior cerebral artery. C. The posterior cerebral artery. D. The posterior inferior cerebellar arteries. The answer is A. The middle cerebral artery. The most common artery occluded in ischemic stroke is the middle cerebral artery, which supplies a large percentage of the frontal lobe and the lateral surface of the temporal and parietal lobes. Occlusion of this artery affects the motor and sensory areas of the face, throat, arm, hand and the areas for speech. Which of the following is the most common etiology of intracerebral hemorrhagic stroke? A. Medications. B. Arteriovenous malformation, AVM. C. Trauma. D. Hypertension. The answer is D. Hypertension. Hypertension is a leading etiology in intracerebral hemorrhagic stroke. Chronic hypertension can cause damage and stress to the blood vessel wall, leading to aneurysm or increased risk of spontaneous rupture. AVM, trauma, and medications such as blood thinners are all also responsible for a significant, though lesser, number of hemorrhagic strokes, or may be comorbidities that increase the risk of a rupture in the presence of prolonged hypertension. What is the most common cause of meningitis? A. Viral infection. B. Aseptic inflammation. C. Bacterial infection. D. Fungal infection. The answer is A. Viral infection. All of the answers given are possible causes of meningitis, but the most common, and least severe, etiology is viral. There is no vaccine for viral meningitis, but there are vaccines for 3 different organisms that cause bacterial meningitis. Neisseria meningitidis, meningococcus. Streptococcus pneumoniae, pneumococcus. Haemophilus influenzae type B, Hib. A client has a history of spinal injury and the nurse is evaluating the client with the onset of new symptoms. The symptoms include hypertension, a throbbing headache, a slow heart rate of 40 beats per minute, and piloerection. The nurse recognizes these symptoms are consistent with what disorder? A. Brown-Séquard syndrome. B. Spinal shock. C. Neurogenic shock. D. Malignant hypertension. E. Autonomic dysreflexia. The answer is E. Autonomic dysreflexia. These symptoms are evidence of autonomic dysreflexia, which is a sequela of spinal shock. It is a medical emergency and requires immediate intervention as it may lead to stroke, cardiac arrest, coma or death if untreated. A 23-year-old male college student presents to the emergency room after experiencing a high fever, nausea, vomiting, and knuckle rigidity. The nurse recognizes that this combination of symptoms are indicative of bacterial meningitis. The nurse is aware cranial nerve dysfunction is related to the condition. Which of the following cranial nerves, CN, is correctly matched to its dysfunction? A. Irritation of CN6 may cause hearing disturbances such as tinnitus. B. Irritation of CN5 may lead to loss of the corneal reflex. C. Irritation of CN3 may cause papilledema as seen with increased intracranial pressure. D. Irritation of CN2 may cause ptosis, a drooping of the ipsilateral eyelid. E. Irritation of CN8 may cause deficits in facial movements. The answer is B. Irritation of CN5th of may lead to loss of the corneal reflex. The trigeminal nerve, CN5, is responsible for both sensory and motor functions of the face, including the corneal reflex, which is also mediated by the facial nerve, CN7. CN2, optic nerve, affects vision, including causing pupilledema, swelling of the optic disc. CN3, oculomotor dysfunction may cause ptosis. Cranial nerve 8, vestibulocochlear, is responsible for hearing, and cranial nerve 6, abducens, is responsible for horizontal eye movements. A 27-year-old female presents complaining of an inability to smile normally or close her left eye. She states that she woke up and noticed that the left side of her face was not responding when she tried to blink, smile, or speak. She also feels a pain in her left ear. She has never experienced this before. The nurse does a physical exam, which is notable for left-sided upper eyelid retraction, general left-sided facial muscle weakness, and left-sided brow droop. There are no cognitive or sensory defects noted. What is the most likely cause? A. Otitis interna. B. Myasthenia gravis. C. Bell's palsy. D. Transient ischemic attack. The answer is C. Bell's palsy. The symptoms and physical exam of this patient are consistent with the diagnosis of Bell's palsy, a rapid onset cranial nerve disorder that results in unilateral facial paralysis or weakness. Symptoms usually come on within 24-72 hours and may include facial tingling, ear pain, taste disturbance, headache, issues with balance, cognitive changes, and clumsiness. A young woman presents to a clinic complaining of unilateral headaches that she describes as throbbing, like a hammer was hitting my head. She experiences these headaches 5 to 10 times per month, and an episode can last up to 24 hours. During the headache she is sensitive to light, sound, and smell. On a few occasions the pain has been severe enough to induce vomiting. She feels better with coffee, and by lying down alone in a dark room. Her headache is most likely which of the following types? A. Sinus. B. Tension. C. Migraine. D. Caffeine withdrawal. The answer is C. Migraine. The symptoms this individual describes are most likely due to migraine headache, migraine without aura, also known as common migraine. Migraines are diagnosed by the following criteria: more than 5 episodes, lifetime. Headache lasts 4 to 72 hours. During headache at least one of the following: nausea, vomiting, photophobia or phonophobia. Headache has at least 2 of the following characteristics: unilateral, moderate or severe pain intensity, pulsating. Aggravation by normal physical activity, may cause avoidance of normal activities of life. Not attributed to another disorder. A 37-year-old man comes into the clinic for chronic headaches. He describes his headaches as in his forehead and temples bilaterally, occasionally wrapping around his head toward his neck. Pain is rated as a 4 out of 10. He has these headaches around 3 times per week. No photophobia with his headaches, no nausea or vomiting. Headache feels better when he presses on his scalp. When asked to describe the sensation of the headache, he replies that it's like a band around his head. These headaches are not preventing him from normal activity. These are most likely what type of headache? A. Cluster headaches. B. Ocular migraine. C. Classic migraine. D. Tension headaches. The answer is D. Tension headaches. The symptoms described by this individual make tension headaches the most likely diagnosis, Tension headaches are defined by the following criteria: minimum of 10 episodes occurring on less than 15 days per month for at least 3 months. Headaches last from 30 minutes to 7 days. Headache has at least 2 of the following qualities: mild or moderate intensity, bilateral, pressing or tightening, non-pulsing, quality, not aggravated by routine activities of daily living. Both of the following: no nausea or vomiting. Either photophobia or phonophobia, but not both. A 21-year-old male presents to clinic for extremely painful headaches. Pain is felt above the left eye and described as a 9 out of 10. Headaches are short, most episodes last for 30-45 minutes, and always on the left side. He notices that during an episode, his left eye will become red and watery, and his nose will run on the left side. He has up to 3 episodes per day. During a headache he will become agitated and restless, and will pace, groan, and hit the wall or floor with his fist. He is very concerned that he may have a brain tumor, meningitis, or some other serious condition. His headaches are most likely which of the following types? A. Tension headache. B. Migraine without aura. C. Migraine with aura. D. Cluster headache. The answer is D. Cluster headache. The presentation of this patient's headaches would make cluster headache the most likely diagnosis. Cluster headaches are defined by the following criteria: at least 5 attacks, severe unilateral orbital, supraorbital or temporal pain lasting 15 to 180 minutes. Headache is accompanied by at least one of the following: ipsilateral conjunctival injection and or lacrimation, ipsilateral nasal congestion and or rhinorrhea, ipsilateral eyelid swelling, ipsilateral facial sweating, ipsilateral miosis or ptosis, restlessness or agitation. Attack frequency ranges from every other day to 8 per day. Not attributed to another disorder. Which of the following is not a common trigger for migraine headaches? A. Caffeine. B. Medication. C. Food allergies. D. Lack of sleep. The answer is A. Caffeine. While caffeine may be a migraine trigger for certain individuals, in the majority of people who experience migraine headaches, caffeine provides significant relief of pain. This may be due to its antagonizing adenosine receptors, which has the effect of cerebral vasoconstriction. Caffeine withdrawal, however, is a common cause of headaches and may trigger migraine in susceptible individuals. Other common migraine triggers include food allergies, medications, bright lights, stress, lack of sleep, hormone fluctuations, strong odors, alcohol, and certain types of exercise. Which of the following seizure types is characterized by a brief loss in muscle control, often resulting in a fall or collapse, in the absence of spasm or rigidity? A. Myoclonic seizure. B. Tonic-clonic seizure. C. Absence seizure. D. Atonic seizure. The answer is D. Atonic seizure. Atonic seizures are characterized by brief, 2 to 15 second, loss or lapses in muscle control, resulting in sudden relaxation of the neck, legs, or whole body. This seizure type frequently causes injury due to falls or head trauma. There may be spasm or twitching at some point during an atonic seizure, but they generally present without any form of rigidity or clonus, unlike tonic-clonic and myoclonic seizures. Atonic seizures differ from absence seizures in that an individual experiencing absence seizures will generally only experience a loss of consciousness, without an accompanying loss of muscle control. Which of the following symptoms describes a typical aura experienced during a complex partial seizure? A. Visual disturbances such as sparks, color fluctuations, or blurry vision. B. Olfactory disturbances, unusual smells, smelling things that are not present. C. A sense of déjà vu or a feeling that everything is strangely unfamiliar, jamais vu. D. Odd taste in the mouth. E. All of these are correct. The answer is E. All of these are correct. The aura experienced before a seizure, while frequently thought of as a primarily visual experience, can include disturbances in taste or smell, bodily sensations such as stomachache or tingling, anxiety, or a sense that everything is oddly familiar, déjà vu, or unfamiliar, jamais vu. Which of the following describes a generalized seizure? A. A seizure that involves a specific area limited to one hemisphere of the brain in which there is no loss of consciousness. B. 30 minutes or more of uninterrupted seizure activity. C. A seizure that involves a specific area limited to one hemisphere of the brain in which there is loss or impairment of consciousness. D. A seizure that involves both sides of the brain simultaneously from onset and results in loss of consciousness. The answer is D. A seizure that involves both sides of the brain simultaneously from onset and results in loss of consciousness. A generalized seizure is one which involves both sides of the brain simultaneously from onset and results in loss of consciousness. This is contrasted with complex and simple partial seizures, in which only one area of the brain is involved and the individual may or may not lose consciousness, in complex and simple partial seizures, respectively. Seizure activity that lasts for 30 or more minutes is a rare and serious condition known as status epilepticus. Any seizure that lasts for over 5 minutes is considered a medical emergency and requires emergency assistance. Which of the following is not a type of seizure? A. Myoclonic. B. Absence. C. Simple partial. D. All of these are seizure types. The answer is D. All of these are seizure types. Currently there are over 40 distinct types of seizures recognized by the medical community. Some of the most common seizure types are generalized tonic-clonic, absence, myoclonic, clonic, tonic, febrile, and atonic. Some other less common types include refractory seizures, gelastic seizures, and acrostic seizures. A 7-year-old girl is having issues in school due to lack of attention. Her teacher states that she will space out frequently for a period of 10 to 20 seconds. During these times she will stare straight ahead and will not respond to questions, even if she is called on directly. She does not have any tics or facial movements during these episodes, other than a slight fluttering of the eyelids. Her teacher states she does this several times during the school day, and that it is impacting her performance in school because she is unable to remember what the teacher was talking about during the spell. This child is most likely experiencing which of the following types of seizures? A. Atonic. B. Absence. C. Myoclonic. D. Clonic. The answer is B. Absence. Absence seizures are typified by a brief, 2 to 30-second loss of consciousness in the absence of other symptoms. Individuals with this condition generally will not experience muscle rigidity, as in a tonic seizure, or jerking, as in clonic or myoclonic seizures, nor do they experience a loss of muscle tone, as seen in atonic seizures. Absence seizures present frequently in young children as staring spells and may cause issues with learning or appear as inattentive behavior in school until correctly diagnosed by a medical professional. A 7-year-old girl is having issues in school due to lack of attention. Her teacher states that she will space out frequently for a period of 10 to 20 seconds. During these times she will stare straight ahead and will not respond to questions, even if she is called on directly. She does not have any tics or facial movements during these episodes, other than a slight fluttering of the eyelids. Her teacher states she does this several times during the school day, and that it is impacting her performance in school because she is unable to remember what the teacher was talking about during the spell. Which of the following diagnostic tool would help this child's provider identify her spells as absence seizures? A. CNS ultrasound. B. Magnetic resonance imaging, MRI. C. Computed tomography, CT. D. Electroencephalography, EEG. The answer is D. Electroencephalography, EEG. While CT and MRI may aid in discovering structural abnormalities associated with certain seizure disorders, the correct tool for diagnosis of seizures is electroencephalography, EEG. An EEG can show abnormal surges in brain activity responsible for temporary loss of consciousness in absence seizures. A 3-year-old patient presents for a seizure that occurred at home. To her father's knowledge, she has never had a seizure in the past. She was not ill at the time of the seizure, and she is not on any type of medication. There was no head trauma before the incident. Her father states that her older brother was diagnosed with epilepsy at age 7, and that his grandmother was also epileptic. Is it safe to assume that this child is also epileptic? A. No. Epilepsy is not hereditary, and must present with a history of at least 2 seizure episodes before diagnosis. B. Yes, epilepsy is defined as seizures in the absence of fever, head trauma, or medication. C. No, a diagnosis of epilepsy requires 2 or more seizures without a clear provocation. D. Yes, she has a positive family history for epilepsy, and has had a seizure with no clear provocation. The answer is C. No, a diagnosis of epilepsy requires 2 or more seizures without a clear provocation. While epilepsy may certainly be hereditary, the diagnosis of epilepsy requires the occurrence of at least 2 seizures during 2 separate incidents, regardless of positive family history. These must occur in the absence of provocative factors such as fever, head trauma, or medication. Which of the following is not a form of generalized seizure? A. Tonic-clonic. B. Complex partial. C. Myoclonic. D. Atonic. The answer is B. Complex partial. Generalized seizures are defined as seizures in which both hemispheres of the brain are affected by seizure activity from the onset. There are 4 main types of generalized seizures: tonic-clonic, myoclonic, atonic, and absence. All of these result in loss of consciousness and may or may not cause spasm or clonus. Complex partial seizures, while also resulting in a loss of consciousness, are restricted to one hemisphere of the brain. What is the most common type of seizure in adults? A. Myoclonic. B. Nonpoleptic. C. Simple partial. D. Tonic-clonic. The answer is D. Tonic-clonic. The most common type of seizure in adults is the tonic-clonic seizure, also known as grand mal. These seizures have two stages: a tonic stage, characterized by muscle stiffening and rigidity, followed by a clonic phase, characterized by jerking and twitching of the muscles and the face. Some individuals may have a tendency to have more tonic symptoms or more clonic symptoms, or may go in a tonic-clonic-tonic pattern of alternating rigidity and jerking motions. Individuals in a tonic-clonic seizure experience loss of consciousness and may experience headache, lethargy, confusion, or may want to go to sleep on recovery of consciousness. Which of the following is a term for total absence of sense of smell? A. Hyposmia. B. Dysosmia. C. Anosmia. D. Hyprosmia. The answer is C. Anosmia. A total loss or absence of sense of smell is called anosmia. It may be caused by a wide variety of medical conditions, including trauma to the head, stroke, nasal blockage, various dementias, viral infection, toxic exposure, autoimmune disease, or zinc deficiency. Hyposmia is a state in which sense of smell is reduced but not absent, while hyprosmia is an increased sensitivity to smell. Dysosmia is an alteration in the perception of smell which may include olfactory hallucinations or distortions. Which of the following is a condition of reduced sensitivity to taste? A. Ageusia. B. Parageusia. C. Dysgeusia. D. Hypogeusia. The answer is D. Hypogeusia. Hypogeusia is a condition of reduced sensitivity to taste. This may be due to various causes, including brain injury, viral infection, zinc deficiency, certain medications such as chemotherapeutic agents or antibiotics. Dysgeusia and parageusia both describe alterations in the perception of taste. These conditions can have similar etiologies to hypogeusia. Ageusia is the total absence of taste perception.